Welcome to another episode from the Veterinary Research Channel. I'm your host, John, and with me today is Stefan.
Hi John, great to be here. I'm looking forward to discussing some fascinating research with you and our listeners today. Absolutely, Stefan. Today we're diving into a recent study published in the Journal of Veterinary Internal Medicine. This research explores a promising new approach for treating a common and often aggressive cancer in our canine companions, diffuse large B-cell lymphoma. As many of our listeners know, lymphoma is a frequent occurrence in dogs, sadly accounting for a large percentage of all blood-related cancers and a significant portion of all malignancies diagnosed in this species.
That's right, John. And B-cell lymphoma is the most prevalent subtype of lymphoma in dogs. The current standard of care typically involves multi-agent chemotherapy, often using protocols based on a combination of drugs like cyclophosphamide, doxorubicin, vincristine, and prednisone. These intensive treatments, known as CHOP-based protocols, can initially be quite effective, with a high percentage of dogs achieving complete remission.
However, despite these initial successes, the long-term outlook hasn't seen significant improvement in many years. The median survival time for dogs with B-cell lymphoma treated with CHOP has remained in a similar range for the past 3 decades, which is something the veterinary oncology community is actively working to improve.
Exactly, John. This is where the research we're discussing today comes in. In human medicine, the treatment of diffuse large B-cell lymphoma has been revolutionized by the addition of rituximab to the CHOP chemotherapy regimen. Rituximab is a humanized monoclonal antibody that specifically targets a protein called CD20, which is found on the surface of both normal and cancerous B cells. By targeting CD20, rituximab helps to deplete B cells through various mechanisms, ultimately improving patient outcomes significantly.
That sounds incredibly promising for human patients. So, why haven't we seen the widespread use of rituximab in dogs with lymphoma?
That's a crucial question, John. Unfortunately, human rituximab doesn't effectively bind to canine CD20, and therefore doesn't deplete canine B cells. Furthermore, even if it did have some activity, the canine immune system would likely rapidly develop neutralizing antibodies against this humanized antibody, limiting its effectiveness. Recognizing this gap, several research groups have been working to develop canine-specific anti-CD20 antibodies, essentially creating a canine-ized version of rituximab.
And the study we're focusing on today investigates one such antibody, right?
Yes, John. This study focuses on a canine chimeric anti-CD20 antibody called 1E4CIGGB. This antibody was developed through a collaboration and had previously shown promising results in healthy beagle dogs, demonstrating effective and long-lasting depletion of B cells in a dose-dependent manner. The current study aimed to take this research a step further by evaluating the safety and effectiveness of combining this canine-specific antibody with a low dose of the chemotherapy drug doxorubicin in client-owned dogs that had been newly diagnosed with B-cell lymphoma. This research was supported in part by a grant from the National Cancer Institute, highlighting its significance. The primary goal was to assess how well the antibody depletes B cells in these dogs and to monitor for any adverse events associated with its use.
That sets the stage nicely, Stefan. Let's move on to what the researchers actually found in this study. What were the key results?
The study enrolled 42 client-owned dogs that had been diagnosed with previously untreated B-cell lymphoma. All of these dogs had their B-cell lymphoma diagnosis confirmed through flow cytometry, which identifies specific markers on the cells, and most also had it confirmed by a biopsy of their lymph nodes. The majority of these dogs had diffuse large B-cell lymphoma, which is a common and often aggressive form of the disease. The dogs were enrolled in an open-label clinical trial and received the 1E4CIGGB antibody along with doxorubicin and, in some cases, one of 3 different immunomodulatory regimens. To see how well the antibody was working, the researchers monitored the dogs' B-cell levels using flow cytometry performed on blood samples taken at each visit.
And what did they observe regarding the B cells?
The results showed a statistically significant depletion of CD21 positive B cells within just 7 days following the first infusion of the antibody. CD21 is a marker found on B cells, so this indicated that the antibody was indeed targeting and reducing the number of these cells. Importantly, this depletion persisted throughout the treatment period, with B cell levels remaining very low even at day 21. In contrast, the levels of CD5 positive T cells, another type of immune cell, remained unchanged throughout this period. This suggests that the antibody was specifically targeting B cells, as intended, without affecting this other important immune cell population.
That's encouraging. So, the antibody effectively did its job in reducing B cells. What about the recovery of these cells after treatment?
The researchers also followed the dogs over a longer period to see when their B-cell populations would start to recover. They found that B-cell recovery was delayed in many dogs, often taking several months. For instance, in the 17 dogs that remained in the study at day 196, which was more than 4 months after their last antibody treatment, only about 35% had B-cell counts that were more than half of their original baseline levels. This indicates a sustained B-cell depletion in a significant proportion of dogs for a considerable time after the antibody was administered. When they looked specifically at the 6 dogs that were still in remission at around day 300, they found that the majority, about 67%, had B-cell counts that were more than half of their baseline, suggesting that recovery does eventually occur in most cases, but it can be quite delayed.
That's interesting information about the duration of B-cell depletion. What about the overall response of the dogs to the treatment?
The study reported that the majority of dogs, around 79%, experienced a complete remission by 3 to 4 weeks after starting treatment. An additional 21% experienced a partial remission, resulting in an overall response rate of 100%. However, it's important to note that none of the dogs that initially had a partial remission went on to complete the entire planned treatment protocol.
100% initial response rate sounds fantastic. Now, what about the safety aspect? Were there any significant side effects associated with the antibody?
Overall, the canine anti-CD20 monoclonal antibody, 1E4CIGGB, appeared to be well tolerated when administered with doxorubicin. Across the study, a total of 160 doses of the antibody were given. Only one dog experienced an acute vomiting episode during an infusion, which resolved by slowing the infusion rate and giving an anti-nausea medication. This same dog later had a suspected type 1 hypersensitivity reaction, similar to anaphylaxis, immediately after its last antibody infusion. This reaction was rapidly and successfully treated with steroids, fluids, and epinephrine. No other infusion-related reactions or hypersensitivity events were directly linked to the antibody administration.
That's reassuring to hear that severe reactions were rare. Were there any other notable adverse events?
The researchers did observe some other issues. 5 dogs developed mild to moderate azotemia, which is a buildup of waste products in the blood that can indicate kidney problems. Even though their urine cultures were negative for typical bacteria, these cases were suspected to be related to pyelonephritis, a kidney infection, as their kidney values generally improved with antibiotic treatment. This is interesting because in human patients receiving rituximab, there's a known association with a higher risk of bacterial infections, including those of the urinary tract and kidneys. It's hypothesized that the B-cell depletion in humans might lead to a loss of protective antibodies, increasing infection risk. The researchers in this canine study suggest that a similar phenomenon might be occurring, possibly involving a type of bacteria called ureaplasma, which isn't easily detected by standard urine cultures.
That's a potential area for further investigation. Were there any other common side effects?
Yes, the study did note gastrointestinal and hematologic adverse events, such as nausea, vomiting, diarrhea, and changes in blood cell counts like neutropenia and thrombocytopenia. However, the researchers considered these to be consistent with the toxicities commonly seen with the other drugs included in the treatment protocols, particularly doxorubicin and the immunomodulatory agents. Importantly, no dogs required hospitalization due to these gastrointestinal or hematologic side effects.
Moving on to the discussion of these results, what were the main takeaways and implications of this study according to the researchers?
The researchers highlighted that while standard chemotherapy is initially effective for canine diffuse large B-cell lymphoma, long-term survival has plateaued. The success seen with the addition of rituximab to chemotherapy in human patients has driven the need for effective CD20 targeting therapies in dogs. This study, they emphasize, represents the first evaluation of this specific canine anti-CD20 monoclonal antibody, 1E4CIGGB, in dogs with this type of lymphoma.
And the fact that it effectively depleted B cells seems like a significant step forward.
Absolutely, John. The durable depletion of circulating B cells observed in the study mirrors the activity seen with this antibody in healthy research dogs. The duration of B-cell depletion in the canine patients, with many showing low levels for several months after treatment, is also somewhat similar to what's seen in human patients treated with rituximab, although the recovery timelines may differ slightly.
However, the study also noted that the extent of B-cell depletion didn't directly correlate with the overall outcome in these dogs. Why might that be?
That's a crucial point, John. The researchers suggest that the relatively small number of dogs in each treatment group and the fact that they received various combinations of immunomodulatory drugs alongside the antibody and doxorubicin likely made it difficult to establish a clear link between the degree of B-cell depletion caused by the 1E4-CIGGB and outcomes like progression-free survival and overall survival. They also point to their recent work suggesting that the underlying genetic characteristics of the tumors at the time of diagnosis can influence how well dogs respond to these types of chemoimmunotherapy protocols. Therefore, it's likely a more complex picture than just B-cell depletion alone determining the final outcome.
That makes sense. So, while B-cell depletion is important, other factors are also at play. The researchers also considered whether the doxorubicin or the other immunomodulatory agents might have contributed to the B-cell depletion. What were their thoughts on that?
They believe that the B-cell depletion observed was primarily a result of the 1E4-CIGGB antibody. They cite previous research in dogs with lymphoma that showed doxorubicin alone doesn't significantly change B-cell counts, while CHOP protocols, which include multiple drugs, do cause a decrease. Given that T-cell numbers in this study were not affected, it further supports the specific action of the anti-CD20 antibody on B-cells. Additionally, the prolonged B-cell depletion seen in some dogs long after their last doxorubicin dose suggests the antibody's lasting effect. While they acknowledge that some of the immunomodulatory agents used in the different treatment groups might have had some influence on B-cells, they didn't observe significant differences in the extent or duration of B-cell loss across the treatment groups, leading them to attribute the main effect to the 1E4-CIGGB.
And regarding the safety profile, the researchers seemed generally positive.
Yes, they concluded that the canine-specific anti-CD20 monoclonal antibody 1E4-CIGGB is effective in depleting B-cells in dogs with diffuse large B-cell lymphoma and appears to be well tolerated with minimal side effects. They noted that it can be safely given in combination with doxorubicin chemotherapy and the other small molecule inhibitors that were part of the study. The rare occurrence of a hypersensitivity reaction is also similar to what can be seen with rituximab in humans.
So, what are the next steps based on this research?
The researchers recommend that future prospective studies with larger numbers of dogs are needed to further investigate the utility of 1E4-CIGGB. They suggest exploring its use specifically in combination with single-agent doxorubicin or even with standard CHOP chemotherapy to better understand its impact on the outcomes for dogs with diffuse large B-cell lymphoma. This will help to more clearly define the role of this promising new therapeutic agent in the fight against canine lymphoma.
This is certainly exciting research with the potential to improve the lives of dogs with this challenging disease. Thank you for breaking down this important study for us, and thank you to our listeners for tuning in to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.